saying, are they equal and strong compared to the opposite side? So if I'm testing C5, it's just push up, yep, that's strong, push up, yep, that's strong. You'll see therapists and doctors kind of roll through this pretty quickly. What we're looking for is, do I feel a difference? And if I do, oh, I feel a difference, then I'm gonna slow down. And I'm gonna say, oh, okay, there's a difference at C5 here. We don't have good shoulder abduction. If I don't, a lot of times, I still report this. A lot of times you will see therapists don't report negative stuff. And again, the idea is if there's no reason to report a negative, you report positive often. In this case, I want to report a negative because I want to know this was the baseline. I want to know I checked their myotones and they were strong. So if you're looking 2 weeks down the road after doing traction and all this kind of stuff, and all of a sudden now they can't lift their arm, that things are going in the wrong direction. So that's a good baseline, even if they're strong and equal, okay? So let's have someone have a seat right up here. This will take a second. Have facing maybe that direction. Doesn't really matter. So she basically is just going to, I'm going to go down through the upper, so it's just basically, I'm going to have her hold her head forward. I'm going to push back. That tests C1, C2. So C1, C2 is cervical flexion. I'm going to test side bending, which is C3. So I'm going to go side to side. Again, I don't have to position her against gravity or anything like that. I'm going to just usually run right down through it. Scapular elevation, so she's shrugging, and then I'm pushing down. Again, if I can, I'm going to test them both at the same time. That takes care of C4. C5 is abduction. She's doing that. I'm pushing down. C6 has two options. Let her relax down there. I can do bicep, which I think is what most people do. Most people do bicep. But C6 is flexion or wrist extension. Sometimes if I think radial nerve, I kind of go that direction. So I go there and I push down. So that's C6, either this or this, okay? C7 is just the opposite. So it's triceps, so I'm here pushing up, or wrist flexors pushing down, all right? So that gets me C7. C8, thumb extension, right? So this, again, I probably have her bring both of them up. So I push, right? And then T1 is finger abduction, abduction. So bring your hands apart, and then I bring them together, all right? Turn around, face this way. So it's C1, C2, C3, C4, C5, C6, C7, 8, T1, all right? And that's pretty much how quick I go through it. It's just, just hold it, and to see if they're normal, all right? Stay that way. So that's a myotonal testing. So we need to kind of know, and again, the concept is, the reason we pick those nerves, or those nerve roots primarily or exclusively go to that muscle group, all right? So it's easy. There are some muscle groups that a couple of nerves go to. We want to avoid testing those, because if one nerve's injured but the other's not, it might give us some false information. So a myotome muscle is selected because of its uniqueness in that it's really basically functioning from one nerve root. That's why we've selected those nerves, okay? Or those muscles. So in the lower about half, we got flexion. So she's just raising up. That's L1, L2, right? L3 is knee extension, so she's just kicking forward, right? Let's see, I forgot L4. L4 is ankle dorsiflexion, right there, right? Again, I'm going to test bilaterally. L5 is big toe extension. So again, raise your toes up and hold it there. Perfect. Then we have S1 and S2. S1 is ankle eversion or plantar flexion, so just pushing down, right? Pushing up, I should say. She's pushing down. S2, knee flexion, holding steady. Don't let me pull it forward, so hamstring, right? Hamstring. So you just roll through that again, checking to see if they're normal. We're testing nerve roots, all right? Remember, nerve roots come out of the foramen. You can go. Let's switch out. Let's make someone else. So again, you're not going to be asked to do that. The only thing I was reviewed, so that's not a practical type of assessment. That is something that you should do. So again, if I say that they had, L5 weakness, you're going to know that, hey, on a recheck, 2 weeks down the line, I might look at their great toe extension again. Or in reality, you might check their great toe extension every time, so you can figure out how weak was it and where's it gonna go to, okay? So again, not something that I'm gonna test you on the practical, just something I thought you should see, because oftentimes you think manual muscle test. So if I were doing C1, C2, you would think, okay, I gotta get them away from gravity, so how is that, and where do I gotta position, I gotta get them laying down and lifting their head up to get a 3. It's not a 3, 4, 5 situation, until you find weakness. Now when I find weakness, so if I'm sitting there and they kick forward and I'm testing their quadricep and that's as far as they can go, number one, I can measure that. Number two, I can say that's not a 3, so I need to probably lay them on their side and see if they're a 2, and if they're a 2, then I can quantify it. So I can say, okay, quad weakness, it's a grade 2, right? So I'm assuming it's this nerve, right? Good enough? So that's how we're going to use that. Now we're going to go through 1, 2, 3, 4, 5 nerve glides. This is stuff that you need to be able to execute, right, from a nerve gliding perspective. Remember, there's a couple of options. We're either going to use always the most proximal segment, which is our neck. And the good news in our upper extremity, we're always just leaning away. So if I'm testing my right arm, part of the glide could just be left side bending. So that's easy. If you're not using that, the second component we're going to use is usually the most distal. And we don't usually deal too much in the fingers. In this case, we're calling the most distal the wrist. So we're usually either doing this, right, or we're doing this, all right? So we're moving some type of wrist motion or some type of head motion to make it a glide or a floss, all right? So one joint or two joint, all right? So let's have someone come up. Let's go through the full upper extremity, and we'll go. So lay on your back. So basically what we're trying to do here is we're trying to stretch the nerve across all of the joints, all right? So it's kind of hard to get your hands in all these places, but again, we've got them supine, all right? Shoulder girdle depression, so I'm pulling his shoulder down. Slight shoulder abduction, all right? We're extending the elbow, right? This is for a median nerve, so median nerve is coming in front, right? Median nerve is coming in front here, so we're going to supinate him, and then we're going to extend. So this is the type of thing, all right? So if he doesn't get much of a stretch there, all I would do, well, first thing what I do, I'd probably do this and this, all right? So now I'm here. So he can feel anything or no. So if he feels something, I'm probably adequate. So all I have to do now is maybe something like this. If I've done this for a couple weeks and maybe we're not getting better or he's not feeling as much, I'm going to just be a little light here. We can tilt your head away. So no, don't rotate, tilt. There you go. So I do this, and then comes back. Come back to, and then go again. So that's true flossing. He and I are working together. He's tilting his head away. I'm tilting his. So one joint would be either him moving his head or me moving his wrist. Two joint would be us working together. He's tilting away, and I'm going away. We'll go over here just so they can see. Easy to do. So some sort of abduction, some sort of depression, elbow extension, wrist extension, and supination, and we're just in this type of position, all right? And then I'm here, so then he can move away, all right? Seem easy enough? The cool thing about the radial nerve is it's basically the same until we get down to the elbow, and then instead of supinating, we're just pronating. So we're doing everything else the same. So if we look here, it says supine with shoulder girdle depression. That's the same. Slight shoulder abduction. That's the same. Extend elbow. That's the same. The difference is instead of laterally rotating the arm, we're medially rotating the arm. So again, remember previously we talked about lateral rotation usually goes with supination. Medial rotation usually goes with pronation. So we're pronating, and then we're going to finger flex. So the only difference between the radial nerve is we're just turning our hand down, and we're flexing instead of extending, all right? So it'll look exactly very close to the same. We're in this position. I'm here, but I'm going to medially rotate, right, or internally rotate, and then I'm just grabbing fingers and hand, and then I'm doing this type of motion, all right? Now you got to be careful here when I do this, especially when I get his fingers. You might feel a muscle stretch. What muscles are we going to be feeling stretching if I do that?
Extensors.
Extensors, right? Why do I feel extensors? Passive insufficiency. Remember that term? So I've got him really stretched. I got him stretched over his elbow. I got him stretched over his wrist. MP joint, PIP joint, DIP joint. So if he says, wow, I feel like a big muscle stretch, that's not a radial nerve stretch. All right, so there's a difference between what you're going to feel there. So we're here. I think it also says we can slightly ulnarly deviate, right? So we're here and here, all right? So I might be getting nothing there, not too big of a stretch. If I don't get any stretch, he's going to tilt his head away. If he still doesn't feel any stretch, probably not a positive test. But I can do this if I suspect some sort of radial nerve issue. But if he's not feeling any stretch, any symptoms, probably not a major deal. Let's do ulnar nerve. Did you guys see that okay over there? No. Okay. So it's again, the only difference is instead of here, all we're doing is turning his hand over, and we're just going to depress here, and so then it's just grabbing those fingers and rolling them up like that. So we're doing flexion, wrist flexion, finger flexion. It says you can add a little ulnar deviation into it and then side bend away. So the only thing that changes between median nerve is from here, basically here, to here, right? So just a very distal segment. So those are two that are pretty similar. Now the ulnar nerve we'll do the ulnar nerve just to get kind of the upper extremity done, especially because those two are similar. The ulnar nerve is a little bit different, obviously, because it courses along the back of the elbow, right? So we're not going to extend, we're going to flex, all right? The key here is, in one of the ways that at least I learned how to do it, and to teach a person how to do it, and you guys are way too young probably for this, but there was a guy that used to do, I think it was Captain Kangaroo, it was a TV show. I mean, I'm almost too young for it, and I can't quite do it. I don't have quite full motion. But you basically just did this, and you called it your cartoon eyes, because you would turn your fingers upside down. Can anyone do that? I can't do it. Yeah, that back there, that's an ulnar nerve stretch, basically, that position. I don't have the action. When I do that, I feel a massive stretch of my nerve, and my fingers go numb right there. So that's an ulnar nerve stretch. So that's how you can do it. Sometimes they'll say like you're sipping tea type of thing. So that's the kind of a couple of things that you can give people doing that type of concept. But that's an ulnar nerve stretch. Now again, just to go backwards, so you can give a person a medial nerve stretch at home, right? This type of thing. I can have them do that, right? Or I can have them do that for a radial nerve stretch. So these are exercises that you can show them to do at home, right? So we got supine with wrist extension and pronation. So pronation, so we're in this position, right? So we're here, and here again, and basically we're doing that, all right? If he doesn't feel anything, I'm going to have him move away, right? So then we'll go back and forth. Now, basically I'm doing a test. First thing I might want to do is move him away just to see, do you feel nerve symptoms? Do you feel numbness and tingling? I'm stretching the nerve, so that's the test. And then the actual movement is the flossing, all right? So we're in this type of position. So we're extending the wrist in a pronated position with maximum elbow flexion. The key is, and I might have not done that good enough there, you really got to make sure you get maximum elbow flexion, because that's where you get the stretch. So I might have not been pushing him down quite hard enough there. So make sure you get a good little push down to get maximum flexion, okay? So let's do those 3 tests and see what we got.